oral sex producing unstoppable bacteria. Oral sex is producing dangerous gonorrhea and a decline in condom use is helping it to spread, the World Health Organization has said. It warns that if someone contracts gonorrhea, it is now much harder to treat, and in some cases impossible. The sexually transmitted infection is rapidly developing resistance to antibiotics. Experts said the situation was fairly grim with few new drugs on the horizon. Around 78 million people pick up the STI each year and it can cause infertility. The World Health Organization analyzed data from 77 countries which showed gonorrhea's resistance to antibiotics was widespread. Dr. Toda Irwin, from the WHO, said there had even been 3 cases, in Japan, France and Spain, where the infection was completely untreatable. She said, "Gonorrhea is a very smart bug. Every time you introduce a new class of antibiotics to treat gonorrhea, the bug becomes resistant." Worryingly, the vast majority of gonorrhea infections are in poor countries where resistance is harder to detect. These cases may just be the tip of the iceberg, she added. Gonorrhea can infect the genitals, rectum and throat, but it is the last that is most concerning health officials. Dr. Wu said antibiotics could lead to bacteria in the back of the throat, including relatives of gonorrhea, developing resistance. She said, when you use antibiotics to treat infections like a normal sore throat, this mixes with the Neisseria species in your throat and this results in resistance. Thrusting gonorrhea bacteria into this environment through oral sex can lead to supergonorrhea. In the US, resistance to an antibiotic came from men having sex with men because of pharyngeal infection, she added. A decline in condom use, which had soared because of fears of HIV/AIDS, is thought to help the infection spread. The disease is caused by the bacterium called Neisseria gonorrhea. The infection is spread by unprotected vaginal, oral and anal sex. Of those infected, about 1 in 10 heterosexual men and more than 3/4 of women, and gay men, have no easily recognizable symptoms. But symptoms can include a thick green or yellow discharge from sexual organs, pain when urinating and bleeding between periods. Untreated infection can lead to infertility, pelvic inflammatory disease and can be passed on to a child during pregnancy. The World Health Organization is calling on countries to monitor the spread of resistant gonorrhea and to invest in new drugs. Dr. Manika Balasagaram, from the Global Antibiotic Research and Development Partnership, said, the situation is fairly grim. There are only 3 drug candidates in the entire drug development pipeline and no guarantee any will make it out. But ultimately, the WHO said vaccines would be needed to stop gonorrhea. Professor Richard Stabler, from the London School of Hygiene and Tropical Medicine, said, ever since the introduction of penicillin, hailed as a reliable and quick cure, gonorrhea has developed resistance to all therapeutic antibiotics. In the past 15 years, therapy has had to change 3 times following increasing rates of resistance worldwide. We are now at a point where we are using the drugs of last resort, but there are worrying signs as treatment failure due to resistant strains has been documented.